Greetings everyone, my name is Jean-Pierre Kikens and I am today with a Member of Parliament from Australia, Mr. Craig Kelly. Good morning or good evening, Mr. Kelly, how are you doing?
Yeah, good morning, Jean-Pierre. I'm down here in Sydney, Australia, and it's morning time down here. I know it's we're at the opposite sides of the globe, but it's great to be with you with the modern technology that we have today.
That's great. I have to thank you so much for accepting this interview. Mr. Kelly was first elected to the House of Representatives for Hughes, which is in the vicinity of Sydney in New South Wales in 2010. And since then, he has been re-elected 3 times. He's a backbencher for the Liberal Party, which is currently in power in a coalition with the National Party. And he is serving or has served previously on various committees, including on law enforcement, foreign affairs, defense, trade, migration, economics, environment, energy, industry, and innovation. And prior to become a member of parliament, he worked many years in the private sector as an export manager in a family business. So good morning again, and let's clarify, neither you nor I are medical experts. So
Certainly.
we are going to focus on policies, on politics, and on the political economy of COVID and the response to COVID, especially, of course, in Australia. So first question I have for you, what is the mood today with your electorate about the pandemic and the lockdown measures and the response of the government?
Firstly, Jean-Pierre, just to clarify one thing for our international audience. In Australia, we do things sometimes sort of back the front. And although we call ourselves the Liberal Party, we're actually more aligned probably to the Republicans in the USA or the Conservatives in the United Kingdom, even though we're called Liberals and sometimes think that has the opposite meaning in many places in North America. So I just thought I'd clarify that. But look, getting to your question, we've been very fortunate here in Australia. As an island continent, and also with our seasons the reverse of the Northern Hemisphere, we've had very, by world comparisons, very mildly affected by COVID-19. In fact, the attitude of Australians at the moment is basically to have the virus eliminated. And in fact, in most of the states of Australia, that's exactly what has happened. There's been, in the major cities, virtually zero infections for the last several weeks. We've had one small outbreak in the state of South Australia in Adelaide over the last couple of days, but we're talking about dozens of people rather than hundreds or thousands of that we're hearing about in Europe and North America.
So to give some numbers, I checked them, and there have been 907 deaths attributed to COVID so far, for 27,725 cases. So that is about 35 deaths per million inhabitants, and Australia has 25 million inhabitants. So this is extremely low compared to countries such as the US, Spain, Italy, Belgium, UK, Brazil, Argentina, and others with over 700 deaths per million inhabitants. So it's about 20 times less. So how do you feel about it? How do you feel the government has done a good job, or you were just lucky to be on an island?
Look, I think there's one thing also on those numbers, which is interesting. 800 of the 900 deaths have been in one particular state, the state of Victoria. So if you took that state out, we've been very, very mildly affected by the COVID when it comes to health issues. But we've had a real big hit to our economy. This has come at great expense to our economy. And we have, look, there's been some good things done. I think we were one of the first countries to stop the flights to China, coming in from China. We've had a hotel quarantine program over the recent months where anyone that arrives from overseas is forced to go into a hotel quarantine for 14 days. Now, the problem has been that we've got tens of thousands of Australians that actually can't get home at the moment because the number of hotel quarantine places is limited by the availability of hotels. So at any one time, we have hundreds of thousands of Australians overseas. They've been trying to get back into the country, but the government has limited their ability to get back in by the number of hotel quarantine places. We've also seen in the state of Victoria, where they did have a significant outbreak, some of the most scenes of police conduct that you would expect to see, behind the Iron Curtain, in going back in the bad old days. The police aggressiveness of police, the violation of human rights has been something that I thought I would never see in my country.
We'll talk a bit further about this, but I'd like to get back to these fatalities, because 678 from the latest numbers occurred in aged care facilities. So the case fatality rate in aged care facilities was about 33%, while
Yes.
outside it was about 0.9%. So what's your take about the governmental response to protecting the most vulnerable in our society who are in these aged care facilities?
Yeah, that's another good point that you make. Also, overall, our case fatality rate in Australia, even though we're coming off, we have relatively low numbers of overall death rates per million population. When it comes to case fatality rates, our numbers are actually not that crash hot. We've had a case fatality rate in Victoria over recent months, something like 3.94%, which when we compare that currently to America and to Europe, that's actually been rather high. And you are right, a lot of those deaths have occurred in the aged care homes. Look, and I think a lot of that has to do with the numbers that I look at and numbers that I see, that the real risk of death to people from COVID is substantially those over 75 years of age or 70 years of age, and it seems to increase exponentially as you go up the age scale. So I think that's also part of the reason why, the fact that aged care homes is where a lot of our elderly people are living.
So you already mentioned this question of hotels, but there was an important outbreak in the state of Victoria in Melbourne, and it was, I think, largely blamed on what occurred at the Stamford Plaza Hotel. Can you tell us that story?
Well, this is probably one of the most catastrophic policy failures in our nation. It involved the state government of Victoria. So the policy was that if you came to Australia from overseas, that irrespective of where you came from, that you were quarantined in a hotel for 14 days. And there was sort of some type of security to making sure that you didn't go out from your hotel and you abided by the quarantine regulations. The Australian Armed Forces helped with that. The police were doing a lot of it. But in the state of Victoria, they decided to subcontract this out to a company that wasn't based in Victoria, that had no record of actually being a government-approved supplier, had no ability to basically do the work other than to subcontract a lot of it. And they just made a complete, absolute muck-up of it. There were stories of security guards sleeping with the guests, just bizarre stuff. So a lot of these security guards then became infected that were meant to be looking after this hotel quarantine program, and then went out and spread the virus through the community. That caused, as you said, something like 700 odd deaths in Victoria, which was very tragic. And it also had resulted in Victoria imposing the most brutal lockdown, I think, of anywhere, in the world. As I said, the scenes, what we saw of police arresting people in Victoria, there was a famous video, and it was of a pregnant mother in a home. The police stormed into her home and were arresting her, and her husband actually had the phone on like as a live feed to record it, a Facebook feed, so everyone could see what was happening. And I was looking at this and I thought, is this real? And then she said, what have I done? As they're handcuffing, she's in her pajamas and they're handcuffing her. And she says, what have I done? What have I done? And the police go, it's about a Facebook post. And I thought this was like, now's the time to laugh. This is actually a joke. You know, you're arresting a pregnant woman for a Facebook post. You know, and then I realized it wasn't a joke. I realized this was actually happening, that someone could be arrested. And she was basically saying that there was a rally to protest against the government. So this was actually quite a shocking incident that has really shocked many people in the country. But saying that, a lot of people, there is a substantial proportion of the community that actually seems not to care about this gross violation of human rights, because they believe that they are being kept safe. And I think that is something that is a real concern, that basic human rights can be trampled upon so easily, and without like a uniform outrage from the community.
So you mentioned these families that are stuck outside Australia right now. I checked a bit some information, and I found that there would be about 6,000 people per week checking in these hotels. And now there are fees of $3,000 Australian dollars per adult and $5,000 for a family of 4 to stay the 2 weeks of quarantine. Is this accepted as a policy in the country?
Well, I find it very troubling, because I have a lot of my constituents that contact me, and their family contacts me and says, look, my daughter or my son is stuck overseas in Europe or in somewhere in Southeast Asia, and they say they can't come home. They can't get a flight back. They get bumped off the flights because there's not enough quarantine places. So I just felt that, to tell your own citizens that they can't return to their country, I think is something that really troubles me and sits very uneasily with me. We've done a lot of things at the federal government to try and increase the number of hotel quarantine places. One of the big issues we had with the state of Victoria following the outbreaks and the disaster and the mess that they had there, they were taking no one in. So any Victorian that was living overseas that wanted to return to Australia had to actually try and go to another state first, and then and of course all the other states were full with their people as well. So I think there's really been a great concern from many people about how Australians are trapped overseas. But again, if you look at there was a recent election in the state of Queensland, and if you look at the recent opinion polls, all the governments are doing very well. So these policies of keeping Australians from coming home again appear to be politically popular, because people think, as I said, it's keeping them safe.
So what about the restriction within Australia between the states?
Well, this has also been another controversial issue. Our Constitution has a section in it that basically says trade, commerce and intercourse, that's the movement of people between the states, shall be absolutely free. And as Australia was set up, our state borders, if you cross state borders in Australia, you almost don't know that you are crossing a state border. But we have states similar to as they do in the USA. But because of this COVID, a lot of these state premiers, which are probably equivalent to the state governors in the USA, that have the power under the Constitution, have actually closed their borders, which was quite bizarre. As you see, the border between New South Wales, the state of New South Wales, and the state of Queensland is basically one side of the road and the other side of the road. So you could walk out of your of an apartment block, walk across to the coffee shop of the road, and you would be going from one state to the other. Now they've put actually a physical border in there and are preventing people from crossing these borders. Now, this has caused enormous distress in our society. There's been some very well publicised cases. For example, there was a young girl from down in New South Wales, and her father was in Queensland, and her father was dying. And she wanted to go and see her father before she died. She wasn't able to do that. She was stuck in a hotel quarantine. And then she wanted to go and attend her dad's funeral. So here you had a young girl that was 26. All she wanted to do was go to her dad's funeral to comfort her younger daughter and to comfort her mother. But she was denied by the Queensland health authorities to do that. And even though at that stage, the area where she was coming from, there hadn't been one single COVID infection. So 0 infections for 28 days from the area that she was in, and yet they still wouldn't allow her to go to see her father's funeral. There was another couple of other terrible cases where, for example, mothers have had birth of children that needed urgent surgery and urgent medical attention, especially in northern New South Wales, where the closest hospital has always been they would go to Brisbane, because Brisbane is the capital of Queensland, and that's very much on the south, very close to the New South Wales border. So it's only what would it be, a couple of hours drive in a car across the border to Brisbane. But to get to Sydney is a 10-hour drive plus, a much longer flight. And these babies were denied access entering into Queensland, were forced to make the longer trip to New South Wales and actually died. So we've had these situations which has caused a lot of outrage in some parts of the media. But again, the politicians that have been behind these brutally harsh regulations that have actually caused death and unnecessary death are actually politically popular because, again, people think they are being kept safe.
So what you are explaining is far from a return to normalcy, given the fact that even if there are extremely few infected people, that's correct?
Correct. Yes. Even like in the state of Victoria today, even though there's been, not in the entire state, now we're talking a state of about 6.5 million people in Victoria, and I'm sure that's pretty close to the mark. In that state, there hasn't been a single infection for the last 10 days plus. Not one. And it's not because of lack of testing. There's still thousands of tests going on every day. But it's still compulsory in that state to wear a mask outside. And the police are actually vigorously enforcing this legislation about compulsory mask wearing, even though there's 0 infections. And there's medical evidence around the world that questions the use of masks at the best of times. But to force people to wear masks outside, and especially as we're now coming into our Australian summer, in very hot weather, people outside are working to have to wear masks when there are 0 infections and have been 0 infections for numerous days in a row, to me seems like a total overkill. It seems as though a lot of the senior politicians in these states are very reluctant to let go of the powers that they've been, and the rules that they've been inflicting upon people.
Are there other states where you have this kind of mandate to wear a mask outside?
Only in the state of Victoria. That is the only state which is a compulsory mandate to wear a mask. And I said, that is despite 0 infections in that state. It's not as though it's like, somewhere in places in Europe or the USA where the infection rates in a city or a state are measured in the thousands and tens of thousands. Here we have 0, and not just for one day, but for multiple days in a row. And yet the government is still enforcing compulsory mask mandates for everyone that is outside.
So it's only when you're at your house that you don't have to wear the mask? That's how it goes? In
the state of Victoria, yes. But the rest of Australia, so I'm here in Sydney and New South Wales, there is no compulsory mask mandate. It's recommended if you're in high density public transport. And you see people on the streets wearing masks, but there's no compulsory mandate.
So
That's
what
it.
is
That's in New South Wales. So it varies. It varies between state. Victoria is the only state of Australia that has the compulsory mask mandate.
what is the donut day?
Well, the donut's considered a zero, so they've nicknamed it a donut day, meaning in that particular state there was zero infections in that state on that particular day.
So that has become something popular to brand, or what is the
Yeah,
what's
well,
the story there?
it's as you said, people have become very fearful of the coronavirus or the SARS virus, whatever the correct name of it is. People become very fearful, and when they hear that there are zero infections in their area, there's quite a bit of relief, and it does make the government of the day popular if it's able to, if those numbers are coming through.
In terms of unemployment, it seems that right now it is at about 7%, while it was 5% before the pandemic. Do you think that the economy is coping well, or do you think that there is much more hardship than what appears from that kind of number?
Well, firstly, there are small sections that have been really hardly hit. A lot of small business people that own restaurants, people working in the entertainment industry, people working in the tourist sector. Some of those sectors have been really, really smashed. And we hear this phrase that we're all in this together, which is a complete nonsense. There's some people that have done it 1,000 times harder than others. But just on our employment numbers, one thing that there's a little bit of masked unemployment there, because when the governments had the policy of locking things down and closing things, we brought in federally basically a government welfare scheme called JobKeeper. And what it was, that it was $750 a week payment that was given to everyone, or given to the businesses that had a 30% decline in turnover. So anyone that was actually, so people at the moment, even though they may not be working, they are still getting a payment from the government of $750 a week, and they are not included in the unemployment numbers. So we really won't see the full effect of what the true unemployment numbers are until this scheme ends in the new year. And the other thing, the problem we've had because of this scheme, a lot of businesses that I talk to, a lot of industries are saying, we can't get workers. We can't get people to work. And in fact, in some of the regional areas where often we rely upon overseas, we have a migrant worker program where workers come in from the Pacific Islands to pick a lot of the work in the agricultural industries. They're picking mangoes and apples and crops and blueberries and strawberries and everything. And a lot of backpackers would also do that work, where they would come from Europe on a working holiday and they'd be able to get work in the agricultural industry. These businesses can't get workers. And we've actually have cases here now. We've got orchards pulling out their fruit trees because they can't get enough workers to pick the fruit. And yet at the same time, we've got the government handing out free checks each week for $750 for people to sit at home. So we've got to relook at that balance of what we have. It's been a very generous welfare scheme, which of course has been very well accepted. But to do it, we've had to borrow something like $250 billion.
So the strategy, if I understand well, is to lock down if there are spikes in infections and then to relax. How do you see it as? Do you think it's sustainable as a solution to prevent the virus to really take foot in the country?
The one thing that has really concerned myself from this perspective, I don't think there's been a full, if you want to call it a cost-benefit analysis of these lockdowns. Now, every time that you so-called lock something down and you take away restrictions and close businesses down, there's a very significant cost. Just for one example, we've heard from the Australian Federal Police that these lockdowns have seen over 100% increase in child sexual assaults, which is just shocking. The numbers of the increases in suicide rates are still yet to come through, but there's been reports of very large increases in people engaging in self-harm. We've seen from elsewhere around the world the data coming through where from a lockdown people delay getting medical treatment, and that has a long-term cost. They delay getting diagnosed for illnesses, and that has a long-term cost. The long-term cost of these lockdowns, I don't think is really being considered. It seems to be almost like a myopic, singular focus on how many infections today and driving the infection rate down, where to me it's not quite the right parameter. The parameter should be the number of deaths. You want to, if someone gets crooked and has a runny nose or may even be asymptomatic, that's one issue. But what you want to do is make sure you're driving you're minimising the deaths from COVID. And I just don't think that there's really been a full, proper analysis of all the costs of these lockdowns to weigh them up against what the benefits have been. And I fear there's been many doctors screaming out loud, and there's been hundreds of doctors who have signed petitions saying, look, I think the cost of these lockdowns, you're doing more harm than you are doing good. And I think in time, when we do a full accounting of the situation, I fear they may be proved correct.
What about the tourism industry? What about international students? Is this going to isolate completely Australia from the rest of the world?
Well, this is the issue that we have going forward. Tourism and international students coming to the country are one of our biggest export earners. I know it often seems, how do you equate international students with export? We have hundreds of thousands of students that come from mainly Southeast Asian countries into Australia to study in Australia in our universities. Of course, with them, they pay for those courses. They bring money with them. They're buying goods and services when they're here, and they make a very large contribution to the economy every year. Now, this year has basically been a year where we've had no international students, so that's been one very big sector of the economy. It's been absolutely devastating. The other one is our international tourists from overseas. Australia is a wonderful and sought after tourist destination, and a lot of businesses rely upon international tourists. Now, firstly, if you can get a flight, anyone that comes in has got to spend 14 days locked up in a hotel room. Now, that's just killed it. No one wants to, on their holidays, spend 14 days locked up in a hotel room where you can't go outside before you go and do things. So that's also had an enormous hardship on our international tourism sector. One thing that we are offsetting that with, that likewise, Australians can't travel overseas. So if I wanted to travel overseas today, I would have to go and get a special permission from the government, which again is something that sits very uncomfortably with me. And if you said, look, I want to go and have a holiday in Hawaii or the Fiji Islands, the government would say no. You would not be allowed. So a lot of the people previously travelling, Australians travelling overseas, are now travelling more internally within their state where they've been able to without the restrictions. So that's helped offset it a little bit, but of course it varies from business to business. So, but we can't go on like this forever. This is the issue. I think you can maintain some of these policies for a short period of time, but what happens if the coronavirus infections in the rest of the world go on for years. Where do we stand? Do we stay? You can't stay locked down permanently.
So what about airlines? Are they going to be supported by the government financially, or what's the story there?
We have two major airlines in Australia. There's Qantas, which is a major international airline. They've done it very, very hard, and of course had sustained quite substantial losses. The other airline we have is Virgin, which actually went bankrupt and actually closed down, and new owners have come in. They've recapitalised the business, but there's only a very small number of internal flights within Australia. The international flights are still the flights moving for the air freight, so air freight's still moving in and out of the country. And there's flights returning Australians from overseas. So the airline industry, everyone that has been involved has had taken a very, very hard hit in the airline industry. That's one of the industries that has been absolutely smashed, and I think will take quite a while to recover.
And from your perspective, the business community, which is known to be very strong in Australia,
yes.
Is the business community accepting the policies, the extremely strict policies of the government in terms of international travel, in terms of all these restrictions we talked about, or is there some doubts expressed about the cost-benefit aspect of it?
Yeah, well, I know the CEO of Qantas Airlines has been very critical of some of the internal restrictions between the states. They like to have restrictions between New South Wales and Queensland when, there's basically zero infections in Queensland and basically zero infections in New South Wales. And to demand that there be 28 days without a single infection in a particular area before they'll open up flights between different parts of the country. I think the CEO of Qantas Airlines has a very good argument there. Fortunately, when it comes to a lot of our important industries, such as our mining sector, we've been able to keep those going, and they haven't been so much affected, which has been very good. I think our Prime Minister, one of the best decisions that he ever made is when there was pressure on, we go back several months now, close everything down. People saying, close everything, shut everything down. The Prime Minister said, no, we're going to keep our mining sector open. We're going to keep our agricultural sector open. We're going to try and keep the factories open everywhere we can. And that was, I think, one of the most things that actually, if he had have gone down the track of closing those sectors down, he would have absolutely destroyed the economy. But he didn't. He listened, I think, to his gut instinct. And I think that's one of the most important decisions I think history will show that he ever made, was making sure that we kept those sectors open and kept those sectors going. Otherwise, there would be no economy to pay for anything.
So if we are talking together, is because you took a stand regarding early treatment. So can you explain how you developed this argumentary disposition regarding early treatment, while it seems that it's you are very isolated in Australia regarding that question?
Yes, well, this goes back several months now to the start of the the pandemic, and first of all, you try to find out and read as much as you can, look at as much information, because when something is unknown, it can be quite scary. And I came across, someone sent me a video, it was a YouTube video of a Dr. Zelenko out of New York, and he gave a very upbeat presentation. It was a message to President Trump, and he said, look, President Trump, I believe, I've got a treatment that will greatly reduce the number of infections and the number of deaths. And he said, look, it's hydroxychloroquine combined with zinc and an antibiotic, and I believe this is very effective. And I thought this was a wonderful upbeat message. And this Dr. Zelenko character, I'd never heard of him before, and he had sort of like the big, sort of bushy beard. And I thought, well, before I repost this, I better actually do a bit of just double checking to make sure this is actually this is actually correct. There is a Dr. Zelenko. This actually is what he's saying. So I did a few Google searches, and I was convinced that it was as we say, ridgy-dig enough to post on my Facebook page. I posted on my Facebook page. Anyhow, the YouTube actually then censored and deleted his video. And I got a call from one of our leading media organisations demanding that I apologise for posting this false information. I said, hang on a minute. I said, how does YouTube know that this doctor is not correct? I said, what medical experts are there at YouTube to say that this Dr. Zelenko is wrong? And surely, if as a legitimate medical practitioner, I should be allowed, or the Australian public should be allowed, to hear what this doctor has to say. Whether he's right or wrong is not the point. You shouldn't be censoring him, right, unless there's absolutely irrefutable evidence that he is wrong and saying something very dangerous. I said, and that should be decided by other medical experts, certainly not by probably arts graduates, with respect to arts graduates at Facebook or at YouTube. This is bizarre. I said to the journalist, you are missing the story. The story is not I posted something that is censored. The story is, why is YouTube censoring what this doctor has to say? So since then, I followed the debate very closely. As I said, I'm not a medical person. I don't have any medical background, but I've read all the medical papers. Anyone can read all those medical papers. They basically rely upon statistics. You don't need a medical degree to understand the numbers. I've then heard of people like Professor Harvey Risch, Professor Didier Raoult out of France. I've heard of, as you said, Dr. Zelenko. I've seen the work of, I think it's Brian Tyson out of California, something like 2,000 patients, one hospitalization, 0. So all the evidence to me was absolutely overwhelming. I think today there's something like, for early treatment in the medical literature, there's most of it peer-reviewed, the majority peer-reviewed, something like 22 studies showing that early treatment with hydroxychloroquine and preferably zinc is effective at reducing infections and reducing deaths. And the probability of if it was snake oil, and I was just tossing a coin, and these were random, all these studies. You can criticize one study and find something wrong with every study. No study is going to be perfect. But to get 22 out of 22, I think the probability is something like 1 in 4 million. And yet we still have health bureaucrats in Australia that have decided that this treatment should be banned. And again, I come probably from a ideological position to start with, that you're a doctor, and there's a bond between yourself and your doctor. It's a sacred bond. And you should be able to sit down with your doctor, and you trust your doctor, and your doctor uses his medical experience about what he thinks is the best treatment for you. And there's no guarantees, and everyone understands there's no guarantees that your doctor is going to be right. That's why we have the common expression, go and get a second opinion. But that bond is there between the doctor and the patient. So you rely upon the doctor's expertise. But for bureaucrats at the government level to step in and override that and say, we know better, and we are going to we don't care what you think as a medical doctor. We are not going to allow you to prescribe hydroxychloroquine to your patient. That is now banned. And if you do, you'll be struck off. And bizarrely, in the state of Queensland, if a doctor did that, they would get 6 months in jail. So where you see, I think you may have interviewed him, that Dr. Brian Tyson, 2,000 patients, one hospitalisation, 0 deaths. If he did that in Queensland, where he treated his patient with hydroxychloroquine, he would face 6 months in jail. Now, I just think this is completely wrong, completely absurd, and I've been prepared to call this out in our Australian Federal Parliament and just say this is not right. you should, it's not about me saying whether a particular drug works or not. It's simply about that a doctor should have the freedom to prescribe a treatment to his patient if that doctor thinks it has the potential for saving his life.
So what about your constituents? Are they supporting your position?
Look, I've had absolutely enormous support from my constituents, because anyone that looks at the evidence can come up with no other conclusion. But saying that, I've also had a lot of personal attacks and personal vilification in the media. Right across the media, I'm attacked, and the media just say things that are completely untrue. I've got several cases, legal cases at the moment against these media organisations, and they're saying, "Oh, you're just saying stuff. There's no evidence. You're saying stuff without evidence." They make out you some tinfoil hat wearer. I said, "Well, hang on." And they're saying, "Oh, you believe in conspiracy theories." I said, "Well, it's actually the reverse." I said, anyone that thinks hydroxychloroquine doesn't work actually must think that there's thousands of medical researchers around the world that are doing all these fake tests and conspiring together to put all this evidence together to show that it's an effective treatment. So those that are saying that it doesn't work and saying all these studies are all cooked, they're the conspiracy nuts. They're the conspiracy theorists, not the people that are looking at the evidence. Also in federal parliament, look, I've been attacked in federal parliament, the opposite, even though I'm a member of the government, and I'm slightly criticising my side of politics in this. The opposition in parliament, gives me a terribly hard time. They regularly attack me. They've moved motions in parliament to condemn me. It's like almost like a schoolyard where I walk into parliament and the opposition all heckle me, but that only makes me that doesn't work. That only makes me more determined to stick to my guns, to look at the evidence, and to fight for my constituents. Because ultimately, people are dying. It's not as though, often in politics we argue about issues and who should get money and who shouldn't get money and what industry should get a leg up and should be helped some. But this is an issue where people are dying. People are dying in our country by their hundreds, around the world by their thousands and tens of thousands and hundreds of thousands. And to know and to listen to these most esteemed medical experts from around the world, Dr. Peter McCullough, Professor Peter McCullough, say, look, there's an early treatment, this is what we should be doing. And when you look at the evidence that shows it works, and this could save thousands of lives, it becomes very frustrating to me that there's still people that refuse to accept this evidence, that are burying their head in the sands to it, when we've got such severe economic consequences and also the number of deaths.